Imagine you've hit all your marks for the day. You've checked all the boxes, be it at the office, in the pit, or riding the road. You've come home, scrubbed the deck, boiled the bird, fed the cat. Hopefully not the other way around. Suffice to say, you've paid your dues and you have earned yourself a first-class ticket on the Slumber Train Express. But that train is set to derail because you may be primed for a solid night's shut-eye, but your legs have a different idea. Restless leg syndrome, or RLS, is an elusive condition. Scientists are still trying to pin down exactly what causes it. And just trying to explain it to someone who doesn't have it becomes like an exercise in metaphorical meaning making. For example, one sufferer describes RLS as being like a wire cog being wound up as tight as possible with no release. She also describes it as the whole body feeling like it just wants to scream. Sounds severe, I know, but the situation is not necessarily unsalvageable. And today, Dr. Alejandro Centurion will outline an array of methods from the natural to the medicinal that can help relieve RLS. Welcome to Vital Signs, where we learn how to get healthier from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendan Fallon. Dr. Centurion, great to have you back on Vital Signs again.
Well, it's a pleasure to be here with you, Brendan.
This RLS, restless leg syndrome, is it a serious problem, would you say?
Well, it's one of these conditions that can range from being mild and just being a mild nuisance and annoyance for some people. But for many, it can be very severe and distressing. As you well know, we all need good sleep. And restless leg syndrome is one of the top 4 sleep disorder problems that people suffer from. And poor sleep can lead to anxiety, depression, and poor job performance, poor concentration. So those who have symptoms that are more severe or not well treated can certainly be very distressed by this disorder.
Does it always accompany insomnia? Do people have restless leg syndrome without having a sleep disturbance?
Well, most people that have restless leg syndrome, their symptoms begin oftentimes in the evening when they sit down to watch TV or have dinner, just when they're still. Because it's a condition that comes on with stillness in the evening. But others, it just starts when they go to bed and they're lying in bed. And that's the typical time of onset. And for many, it can keep them from falling asleep because they feel this uncomfortable urge or compulsion to move the legs. Other people may describe it as a tingling, burning, cramping sensation. Some people describe it as an itch that you can't scratch. There's a lot of descriptions that people how they describe it, but the underlying common denominator is that people have an urge to move the legs, and movement will help resolve the symptoms temporarily.
I think there's certainly enough to keep us awake at night already in this modern age. I know people who have dealt with this for years without getting any kind of relief from it, and it's, as you suggest, it's kind of this mysterious urge to move the legs often goes undiagnosed or misdiagnosed. And in the past, it's been seen as a psychological issue in some circles. Is that possible, Dr. Centurion? Could it be a psychological issue?
It is not a psychological problem. We do know that there are certain changes in the brain that occur related to dopamine transmission as well as iron levels in the brain that contribute to this disorder. That being said, like many conditions, stress could make it worse. And interestingly, and we may talk about this a little bit later, that some of the medications that are used for treatment do carry a fairly significant placebo effect. I mean, there's about a 40% placebo response in the treatments that we use, suggesting that there is some response that we're getting that's not related to the medication directly. Although, that being said, I would say that many times medications are very necessary and can be very helpful as well.
Do you feel like it's getting more attention now? Is it being taken more seriously?
Oh yeah, I mean, I used to give talks to support groups, and the support groups used to be there because of a lack of knowledge amongst the general practitioners in the community about what this was and how to treat it best. And I would go to the support groups and for that purpose. But the support group now doesn't exist because patients know enough about it. Most primary care doctors know about it, and they make referrals to neurologists. So there's not so much a need for the support group as there used to be.
Is it a genetic problem? Is it something that runs in families?
Yes, it's well recognized that restless legs does run in families. There's about 60% genetic predisposition to this disorder for those who have it. And there's about maybe 6 or 7 genetic loci that have been reported or recognized. So yes, there is a genetic predisposition. That we do know for sure.
In your practice as a neurologist, are you seeing patients with this problem? Do you have any examples you could talk about there, Dr. Centurion?
Yeah, so I'll give you a few examples. So most people with what we call idiopathic restless legs, these are ones where we don't come up with a specific cause, usually it'll begin somewhere in your 20s, 30s, 40s. Conditions, there are other certain conditions that are associated with restless legs that may occur people to develop at a later age, such as, for example, kidney disease, peripheral neuropathy, back pain, radiculopathy, which is our pinched nerves in the back, are some of the conditions that can make it more, that can be associated with it in older age. But let me give you just an example of a patient that I saw recently who was in his 50s and had no history of restless legs in the family and had been having some problems with sleep and had been having some depression. And his primary care doctor put him on some Zoloft or sertraline, an antidepressant, and he was also using some over-the-counter Benadryl for sleep. And he had been developing some pretty significant problems with restless legs. And after talking to him and doing an evaluation, we checked his regular labs, blood tests, particularly focusing one on iron. Iron levels, as we mentioned, low iron in the blood can also signify there may be low iron levels in the brain. Anyways, his levels were normal. But his case illustrates the point that certain medications that we use can actually trigger restless legs. And one of the common ones are medications like Benadryl, antihistamines that are used many times for allergies or for sleep can trigger restless legs. And also many of the antidepressants can also trigger restless legs. So we had him stop both the Benadryl, and we asked his primary care physician to switch him from sertraline to a medication called Wellbutrin, which is an antidepressant that works more on dopamine. It actually raises dopamine levels. It's one of the few antidepressants it does, and does not worsen restless legs. So after he made those changes, he was remarkably better. So it was mainly medication induced in his case.
And I think you mentioned, Zoloft earlier, that it's some people have a side effect, restless leg syndrome, as a consequence of Zoloft. That's a serotonin reuptake inhibitor, if I understand.
Yes, the serotonin reuptake inhibitors are a class of medications, along with the tricyclic antidepressants, which are more anticholinergic, that have all been associated with increased risk of restless legs in susceptible individuals.
Linked to the topic of dopamine, aka the feel-good hormone, the artificial sweetener stevia, of all things, has been implicated in restless leg syndrome. A 2020 paper reported on a man who showed symptoms of RLS while he was using stevia. When he stopped the stevia, his symptoms disappeared. Some months later, his RLS returned within a few days when stevia was reintroduced. It was thus suspected that stevia was lowering dopamine in specific parts of his brain. In a moment, we'll hear from Dr. Centurion about how to determine if you have RLS or something else, and how diet and lifestyle can factor into RLS. But first, here's a look at my interview on back pain with pain specialist Dr. Damon Noto.
When back pain is combined with other symptoms, now you start to feel tingling or numbness in your legs. Okay, now you start to feel weakness in your legs and feet. That's concerning. That should be worked up and you should see a physician. So a very common thing is called sciatica. And usually that's defined as people who have back pain that starts to travel into the leg or shoots down the leg, as we say. Sciatica in itself is not necessarily dangerous, but if you have sciatica and you combine that with weakness or numbness or weird feelings in the legs, it becomes more concerning that you're injuring one of the nerves in your back.
If someone's getting this kind of tingling sensation, is it always signaling specific danger, or are there some occasions where it might not be so serious? Afterward, you can find the link to that video in the description below. I want to just try and understand what this condition is a bit more for our viewers as well. How does someone know if they have restless leg syndrome specifically? What kind of criteria do they have to fulfill for it to be restless leg syndrome?
There has to be that criteria, that urge or discomfort to move the limbs. And there has to be some resolution to that discomfort with the movements, but it's just temporary. And that is really the main criteria for diagnosis. There are some other conditions that may be somewhat similar, maybe related. There's one called periodic leg movements of sleep, where a person, when they're sleeping, they kick their legs around. That's sometimes often more noticed by the spouse. But that per se is not restless legs, and it doesn't usually wake up the person themselves. But it is, people that have restless legs do tend to have periodic leg movements of sleep as well.
I know that people are often advised to back off from sugar, alcohol, I think perhaps nicotine as well, or processed foods is another often common advice, a thing to avoid if someone has restless leg syndrome.
Yes, there's certainly various dietary and lifestyle factors that are clearly related to restless legs. One of the other patients that I saw recently, he was also in his 50s. He had, not been taking good care of himself. He was not exercising, had gained a fair amount of weight. He had developed some borderline diabetes, and he drank alcohol, smoked, and also had a fair amount of caffeine. And the restless legs was really beginning to bother him. We talked about these as being factors that could certainly be exacerbating or causing his symptoms. And he really made a big effort to clean up his life. He started exercising. He cleaned up his diet. He went from the standard American diet to a more Mediterranean type diet, cut back on simple sugars and processed foods. He gave up alcohol, smoking. He made some really big changes. And all of these factors combined drastically improved his restless leg symptoms. How much each one of them plays exactly, it's hard to say, but they were just the combination of all of them made a huge difference for him.
Perhaps you have another example, Dr. Centurion, of a patient you've treated where they've ruled out those kinds of lifestyle diet factors. How have you intervened then to help them with their restless leg syndrome?
For those individuals who've already made the dietary lifestyle changes to reduce the risk of having restless leg symptoms, there's sometimes, again, we have to resort to taking pharmaceutical medications, which can be very effective in many individuals. I just want to mention the iron factor, though, because that's one thing that needs to be addressed. And you want to check for what's called a ferritin. And if it's less than 75, generally iron supplementation is recommended. Or if the transferrin saturation is less than 20 or 25%, it's also recommended to treat. But even sometimes that's not enough.
Ferritin is iron?
Ferritin is a measure of iron stores in the body. That's one of the measures that we do to check when we check for iron levels. Some individuals can just take iron supplementation orally. Some can't tolerate it, though. And even sometimes those who take oral iron aren't able to get their levels up to a sufficient degree, and sometimes require IV iron or intravenous iron. I had a patient like that very recently who was on various medications that we used to treat restless legs. Her iron levels her ferritin level was like 10.
What's the average?
Oh, you want it at least over 75.
Wow.
That level. Yeah, 10 is low. 10 is low. So, and she was already taking iron supplementation, was eating a lot of red meat, and taking vitamin C to try to get her iron absorption improved, but her levels were still low. And anyway, she ended up getting sent her to a hematologist, had IV intravenous iron, and got her levels above that threshold, and her symptoms improved markedly. So, but she still needed to take restless leg medications.
Why is low iron contributing to restless leg syndrome?
The idea behind the low iron is that iron is also felt to be involved in some of the oxygen transport in the brain, as well as dopamine transmission as well. It plays a role in both of these. And so low levels of iron in the body oftentimes reflect in low levels in the brain.
And before you were saying, even if iron is restored, they might still need medication.
What do we do for those individuals who need to take a pharmaceutical medication? There's 3 or 4 main classes of drugs that are used. What used to be used initially were mainly dopamine agonists, or medications that increase dopamine. But those have fallen out of favor recently in the last years because we've recognized that they call what's caused augmentation. Augmentation is a process by which the medication becomes less effective with time, and the symptoms that a person experiences, their restless leg symptoms, may begin earlier in the daytime. Instead of starting at 5 in the evening, they may start at 3 in the evening, or maybe 1 in the afternoon, or even in the morning time. The more we use these medications, the body sort of tends to get used to them, and then again, it augments the symptoms. So we are not using that class of medications now, or at least the Restless Legs Society is discouraging their use. And the medication that's used most now are the gabapentinoids. These are like gabapentin, pregabalin or Lyrica, or a long-acting form of gabapentin called Horizon. And these medications don't tend to cause augmentation. They tend to work very well for many individuals without many side effects. They are usually fairly well tolerated. And then the other medication that sometimes we have to resort to using for other conditions we tend to not want to use are opiates, or the opiate pain medications. But they actually work very well for individuals who have refractory restless legs. And oftentimes you don't really see the augmentation problem as much with these medications either. And you can often get by with a low dose. So those would be the main classes of medications that we use currently to treat restless legs.
The opiates, I guess, would be a last resort almost if the first class weren't proving effective. The first class you mentioned, Dr. Centurion, are they generally covered by insurance for people?
Most of these medications all have fairly good insurance coverage. Most of them all have generic versions, so we're not dealing with brand medications that tend to be more expensive. So yes, they have good, adequate insurance coverage.
I've also heard that supplementing magnesium can be helpful for RLS. Is that something that you've also guided patients on, taking magnesium?
Actually, I didn't mention magnesium. There are some individuals who I found that some magnesium supplementation may help with people with some mild restless leg symptoms. I haven't had it to be that effective for more severe cases. Magnesium tends to help a bit more with cramps, as opposed to necessarily restless legs, although I have had some individuals who've had some benefit from it. So yes, it would be something to certainly, I would certainly recommend, and usually recommend people try some magnesium as well, which is very safe and well tolerated. And one of those supplements that blood levels don't reflect very well tissue levels of magnesium. So we don't usually rely on a blood test in that case. We would just recommend some supplementation.
So people can fairly safely up their magnesium level without worrying too much about side effects?
The most common cause of side effects from magnesium would be loose stools. Certain formulations have less of that side effect. Otherwise, it's standard doses, usually 400 up to maybe 800 milligrams, are safe.
Is there a particular type of magnesium that people should aim for?
I tend to recommend magnesium glycinate. I tend to feel that it has good absorption, and people tend to have fewer side effects from that form of magnesium.
Are there any other aspects of treatment that are important to mention, maybe further in relation to diet or lifestyle? Is there any other aspects?
Well, we mentioned diet. We mentioned exercise. Exercise is definitely recommended. Some individuals with restless legs, if they exercise too late into the evening, sometimes they may exacerbate their symptoms. So exercising earlier in the day is usually recommended. But just staying healthy in general, eating a good diet are really very important for any medical condition, but can certainly go a long way with restless legs as well. For other alternative treatments, there are some studies saying that acupuncture can be beneficial, although it's often something you need to continue doing. It's not going to usually fix it just by doing one treatment.
Acupuncture is, of course, a mainstay of traditional Chinese medicine, or TCM. Based on TCM theory, certain acupuncture points can be used for dispelling internal wind from the body. This is largely what Chinese medicine sees restless leg syndrome as, a problem of internal wind. Now, internal wind is a concept that scholars have struggled for many years to try to translate across culture, language, and medical understanding. So I won't make any pretense of trying to do that here. But to put it in context, wind excess is one of 6 excesses that in TCM theory can lead to disease. The other excesses are cold, heat, dampness, dryness, and fire. Certain modern diagnoses may line up with these, like water retention being an aspect of excess dampness, and fever and inflammation being excesses of heat. But that depends on who's doing the interpreting. Back to restless leg syndrome. Any involuntary leg movement, according to TCM, is caused by excess internal wind. My repeat guest, Dr. Jingduan Yang, says this on his show. The liver is what produces wind, he adds. So the liver is thus implicated in restless leg syndrome, based on traditional Chinese medicine theory, which, as Dr. Yang points out, sees the liver as not just an organ, but the center of the meridian system and an energy hub. What could cause the liver to generate wind? Many factors, it would seem, but bridging the elemental, like wind, and the psychological, Dr. Yang says that anger can be a factor, as the liver is very sensitive to emotions, particularly anger. He also mentions the effects of alcohol abuse, which modern medicine knows to cause liver damage, and Chinese medicine additionally understands to cause loss of yin energy to the liver. Anger and alcohol aside, evidence of acupuncture reducing restless leg syndrome would suggest that tweaking the right acupuncture points can dispel restless internal wind. Dr. Yang, by the way, is a board-certified psychiatrist and integrative medicine doctor and also a practitioner of traditional Chinese medicine. In just a moment, we'll hear from Dr. Centurion about a device that stimulates the peroneal nerve just below the knee to reduce RLS. But first, how do you know if your back pain is serious? I asked pain and rehabilitation specialist Dr. Damon Noto.
Back pain is one of the things that is a huge factor in the US, and it's one of the major reasons people come to see a physician. It's also one of the leading causes of disability in our country. One day you bent over and tie your shoes and all of a sudden, boom, you have severe back pain. Versus, you know what, doc, every morning my back was achy and stiff, and over the past year now I get up in the morning, my back pain is severe. That's two different types of categories of pain, which leads us into different directions to figure out what's going on.
What are the signs in this pain that someone should take notice of, that there's something serious going on? Afterward, find the link to that video in the description below.
And there are also some other treatments that we didn't actually touch upon, which some individuals have benefited from and are becoming, there's a new one that came out just last year. These are neuromodulatory devices. One of them was approved last year. Put it around below your knee and it stimulates your peroneal nerve. And that stimulation of the nerve in your leg seems to work well for many individuals with restless legs and precludes them from having to use medications. It was just approved last year. I don't have a lot of experience yet with it. And there's also a blanket you can put on your legs that provided some stimulation as well. And there are sometimes these compression devices that can be tried at nighttime as well that provide some sensory input into the legs that transmits to the brain and somehow seems to reduce symptoms as well. So there are other options available beyond pharmaceuticals.
We've touched on some of the foods that may trigger RLS. Like sugar or alcohol. Is there anything in addition to that people should avoid that could potentially be triggering their RLS?
Besides, we talked about, you mentioned alcohol, inflammatory diet, nicotine, smoking, too much caffeine, or perhaps some other dietary factors that could be contributors. But I think we kind of covered most of them.
What about illicit drug use?
Illicit drug use is certainly something that we want to avoid regardless due to its adverse health impact. But I would say that you probably are dealing more with restless legs as a withdrawal of illicit drug use. For example, like if it's using, let's say, using opiates illicitly or benzodiazepines illicitly. These medications are ones that if you're on them for a while and then you stop them cold turkey or stop them, those can definitely cause restless legs. But it's the withdrawal that's more of the issue. It's not often the drug itself that causes it, it's the withdrawal.
Okay. On that note, I mean, earlier you were saying that opiates in some cases are used as kind of a last resort treatment for RLS. What's the crossover there between?
Yeah. Well, with opiates, like I mentioned, they can work very effectively at a relatively low dose to treat restless legs. And if you're on them, once you're on them, if we had to stop them, they need to be weaned off, because if you stop them cold turkey, by all means, you have severe restless leg symptoms. Yeah, so they need to be used, again, under the guidance, of course, of a medical professional and used judiciously. And if they are ultimately stopped, they need to be weaned down gradually.
Dr. Centurion, thank you very much for coming back to Vital Signs and illuminating these very many different aspects of what could be causing RLS, and also the many different ways that it can be treated, to illuminate some hope for viewers who might be experiencing this. Thank you for coming on.
It's my pleasure, Brendan.
We just probed what factors like iron deficiency and certain types of medication could trigger RLS. We also looked at different modes of resolving RLS, like acupuncture. Up next, what could different types of back pain mean? And how do you know when back pain is serious? Find the link to my interview with Dr. Damon Noto in the description below. It's been great to be with you, and I hope you'll stay with us for more cutting-edge vital signs and epochtv health content by clicking that description button just below. I'm Brendan Fallon, and this is Vital Signs.